Autistic people often experience high levels of chronic stress and anxiety. This video is about autistic women and girls and mental health. Social interaction is a core part of daily life, necessary for social inclusion. Many public spaces and environments such as schools, offices and retail centres can be highly challenging. These things often cause a great deal of anxiety for the autistic individual. Anxiety exacerbates the challenges of everyday life everyone has to deal with. A study found that autistic people live 10 to 15 fewer years than the rest of the population. These figures are understood to be the consequence of long-term chronic stress and anxiety and suicide. In a recent survey, it was found that 98% of autistic adults and their carers said stress is a significant issue for them, with 89% adding that it is difficult or impossible to find effective support. Autistic females have been described as like swans, appearing to glide smoothly across the surface of life, but paddling desperately underneath just to keep afloat. They may develop the ability to imitate or to mask their difficulties, but this comes at a cost in terms of exhaustion, poor self-esteem and anxiety. Commonly reported mental health concerns include anxiety, depression, insomnia. Others include OCD, anorexia nervosa and other eating disorders, PTSD, alcoholism, self-harm and suicidality. Research carried out for RightClick found that most respondents had received some form of mental health referral both before and after diagnosis. For the majority, services and interventions offered were partially helpful, and the responses concur with previous research findings that usual mental health strategies may not always be useful for autistic people or may require to be adapted. Comments suggested that the kindness and good intentions of mental health practitioners were often appreciated, but women felt their experiences as autistic individuals weren't always well understood. Self-identity and insight was described as pivotal to positive change. One woman commented, "My mental health issues happened before I was diagnosed with Asperger's. Once I understood that I was on the spectrum, the other symptoms disappeared." What would help? Overwhelmingly, better understanding of autism, specifically for girls and women. Improved training, awareness and understanding in healthcare professionals and services of both autism and autism in females specifically. Specialist mental health support for children and parents from professionals who know about females with autism. Counselling from people with a specialism in autism. Other suggestions included social skills education, meditation, mindfulness, yoga and executive functioning support. This video is one in a series aimed at practitioners and produced through the RightClick programme for women and girls by Scottish Autism. This online support is for autistic individuals, parents, carers and professionals. We've engaged with women and girls from the autism community and we've drawn on the expertise of a network of professionals to produce a range of materials on diagnosis, education, employment, mental health and parenting. We hope you find these resources informative and useful.